Hello everyone, I'm Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University. And it is with great honor that I have been selected to present at the British Society of Rheumatology as representative of Walden University. And in this original research, I looked at inflammation modifies the effect of rheumatoid arthritis and overall mortality among females. So I'm going to explain this to you in the subsequent slides. So the objectives are to understand the role of inflammation in disease development, determine the role of rheumatoid arthritis in all-cause mortality, and then demonstrate models that take into account multiple factors. This is the abstract. I put it in here for the sake of completion. So rheumatoid arthritis is an autoimmune disease that affects approximately 1% of the population and mostly affecting women 2 to 3 times as much as men. What are the goals of treatment? Well, DMARDs were the first line, and the whole idea is to use disease-modifying agents to be able to reverse this. So the first non-biologic for this treatment was methotrexate. More recently, tumor necrosis factor alpha blocker, which is a biologic, has been very effective against not only rheumatoid arthritis but many other autoimmune diseases. And so biologic therapies have been a godsend for this. And of course, there's a concern during the pandemic because it reduces the immunity a lot more. So this was given with caution. So this is the model that I use in many of my research projects you've probably already seen. But rheumatoid arthritis is connected with all-cause mortality, and inflammation modifies this effect. So number one out of the methods, it's conducted on participants aged 20 years or older. We assessed the rheumatoid arthritis status by using an arthritis question, and then C-reactive protein was actually from a lab-drawn measurement. So prospective analysis was conducted because of the linked mortality files that were found. And so Cox regression was used, and known confounders were controlled for, and then we determined the relationship of rheumatoid arthritis and mortality as experienced by the inflammatory biomarkers reactive protein. So this is the results. This is kind of the meat and potatoes of this whole talk. Rheumatoid arthritis, of course, it's causing 198% than the general population when you do have rheumatoid arthritis for overall mortality. Now, looking at the difference between people that have inflammation, people who do not have inflammation, for individuals, patients that have inflammation actually are 162 percentage higher likelihood of overall mortality. Whereas in individuals that are rheumatoid arthritis positive but inflammation negative only have a 28% higher likelihood of mortality. So as you can see, there's a distinction between the two. So in a conclusion discussion, there's a clear connection, of course, between rheumatoid arthritis and increased mortality. Additionally, among females, the connection of inflammatory biomarkers is more pronounced, while this is not as much affected in males. Inflammatory biomarkers such as C-reactive protein must be closely monitored. Thank you for listening. I just wanted to leave you with this model where rheumatoid arthritis is connected to a lot of effect of chronic pain, doctor-patient interaction, compliance, and just take a look at all the different types of constellation of factors that are surrounding rheumatoid arthritis. Thank you for listening.